my channel. Shout out to all the Rocky Pips out there. Yes, fighters. A good Saturday to all of you, and hope you are enjoying your weekend. Yes, we are not doing a makeup haul here. Yes, this is not a makeup haul, but a transplant medication haul. So these are my medication for my kidneys, and yes, all of this my medication for 2 months. Every 2 months, I'm seeing my doctor per prescription and for follow-up checkup as well. So, for this vlog, I would like to discuss with you how I organize my medication and the proper time of taking this medication and for how long I've been taking all this. These are anti-rejection medication, immunosuppressants, and I also have other medications here. So yes, this is how I organize my medication. I put here all my medication near my bed, so it's easy to reach. And also, so I won't forget to take them in the morning and in the evening. So how many medication I have after my kidney transplant? I'm taking 14 types of medication, and it's this transplant medication is categorized into 3. First are the immunosuppressants. Immunosuppressants are anti-rejection medication. These are medications to suppress your immune system, to lower the strength of your immune system, so that it will not reject the new transplanted organ in your body. From the start of after my transplant, I'm taking the same medication that I'm still taking up to now. By the way, this medication will be your maintenance medication. It will be your lifetime medication. So I'm taking Prograp. The Prograp is 1 mg, and I'm taking 4 tablets a day. So 2 in the morning and 2 in the evening. This Prograp, not all transplant patient is taking 4. This really vary on the tacrolimus level in your body. When I started, after my transplant, I'm taking the same 2 in the morning, 2 in the evening, and then it as my kidney transplant progresses, it was lowered down to 2-1, and then 1-1, and then now I'm back to 2-2. That's why it's very important that your tacrolimus level is being tested every 2 months, so your doctor can check the level of the medication in your blood. Be mindful of the time you are taking the tacrolimus. If you are taking it in the morning at 7:30 a.m., you should also take it at 7:30 p.m. It is preferably taken preferably on empty stomach. That's also what I follow. So I'm taking it 7:30 a.m., 30 minutes before breakfast, and then in the evening, 30 minutes before the dinner, or after 2 hours after the dinner. Taking your tacrolimus on different timings will really affect the result of your tacrolimus test result. Like last month, I've experienced of an erratic change in my tacrolimus level. Take it on the exact 12 hours interval. So my doctor has to change the dosage of this medication. 2 months before, my level is 4.4. Then last month, it went down to 3.3. So my doctor asked me if I'm taking my medication on a proper time. But yes, it is my fault that sometimes I forget and I'm taking it like 30 minutes after or 1 hour late. I think there's also a day that I forget to take them. Because sometimes when you are focused in something and your alarms goes and you will say, okay, I'll just take it after a few minutes, but you will totally forget about it, and that affects the tacrolimus level in my blood, which will prompt him to change the dosage of my tacrolimus. He told me that we will redo the test and make sure that I'm taking them religiously every 12 hours. So again, after a week, I took the test again, and yes, it becomes on the right level, 5.5. So he retained me to the current dosage I'm in. So yes, our drugs is really expensive, so let's all be mindful of taking them on the right time. What about side effects? Some side effects of tacrolimus is high blood pressure and
Ano ba?
nakakalimutan ko kasi sasabihin ko. The most common side effects of tacrolimus, if you can read it also in the leaflet of your medication, there is hypertension, insomnia, diarrhea, and also weakness. You will feel pain. So if you if you will experience these side effects, you should inform your doctor so he can tell you what to do on this. So all the side effects and information of the medication is always available in the leaflets inside your medication. So So other anti-rejection medication that goes with our program is this isolone or prednisolone 5 mg. And this I'm taking it every morning during breakfast. Do not take this on empty stomach because one of the side effects of this is it will cause stomach upset. So make sure that you are having food when you take this isolone. And another medication that another anti-rejection medication goes with it is Imuran, 50 mg once a day. I'm taking it every 9 p.m. in the evening before going to bed. So those are the 3 immunosuppressants that I am taking. So the next medication is the anti-infective medication. So this anti-infective medication are the drugs for your infections, because since our immunosuppressant medication is putting us on risk of infection, we need to take anti-infection medication after the transplant. Actually, after my transplant, I'm taking I will check. Yes, I still have my medication list after my transplant. These are my discharge lists. I always keep my medical records with me from the time I was admitted in the hospital for dialysis up to the time of my transplant, and also medical reports from different hospitals that I went to. It comes handy so that when you transfer to other hospital, you can give a copy to your new nephrologist so that he can trace the history of your transplant, your kidney disease. So during that time, I was given cotrimoxazole forte, and valganciclovir. So, this anti-infective medication is given to fight any infection virus in your body, so that it will not infect your new transplanted kidney. Over the years, over the years of transplant, this is my usual problem or reason why I go to the hospital. Since we are immunocompromised, we are having this infection. At times, we easily get infection. So, but for now, I don't have any infective medication. For the last 6 or 8 months, I've never been into the hospital. And yes, thank God. And when this COVID-19 started, I was really very cautious whenever I go out. I put mask and gloves and shoes. I always wear long sleeve because yeah, I'm afraid to get infected given our situation that we are categorized having chronic disease. So the next are the other medications. So what other medication I'm taking right now? I'm taking losartan potassium tablet 50, and I'm taking it also in the evening before going to bed. My doctor rheumatologist gave this to me because I'm experiencing high blood pressure. So it's alarm for my medication. I need to take my medication. It's 10 a.m. here, and I need to take my other medication. At the moment, I'm taking magnesium 243. I'm taking 2 tablets in the morning and also 1 in the evening because my magnesium is very low at the moment. So I'm taking this magnesium. I will take it first. Every time my alarm goes, I need to take it because later I will forget. Yes, so I'm back. Why I'm taking this magnesium supplement? Because I'm having magnesium deficiency. And this why this magnesium is important in our body. Yes, this is important because it supports our muscles and nerve function and for energy production. So I'm taking it twice a day, 2 tablets in the morning, yes, 10 a.m. and then 10 p.m. I'm taking 1 tablet. So what is the side effect of this medication? Diarrhea, loose stools. So yeah, so hopefully after taking this medication, this magnesium, it will help me to reach the correct level of magnesium in my body. After the transplant, there's a lot of additional medication given to you by the doctor. For me, I was given extra 9 medication. I will check because that was long time ago and I already forget about those medication. Yes, I have. And this medication, it will vary depending on your health condition in each patient, because some patients, they have hypertension or they are anemic. So the doctor are giving them additional medication aside from the anti-rejection medication and anti-infective medication. So for me, I was given amlodipine, that is for my hypertension, folic acid, calcium for the calcium, disloratadine, Recormon, ferrous sulfate because I am anemic, omeprazole for the stomach because since there's a lot of medication that we are taking, we need omeprazole for our stomach. And then I'm also having multivitamins, and yeah, those are the additional medication given to me. But over the years, it decreases one by one. The nephrologist is taking off one medication. So yes, as of today, these are all the medication that I am taking. So now it's only 3 medication immunosuppressant, and then this additional 2 medication, hopefully later on when my hypertension is my blood pressure is back to normal and my magnesium level is fine, I will also stop this. So that's it. After 11 years, those are my medication. And what else I keep in here in my medication organizer, I have here, these are a must as a transplant patient. Thermometer, yes. If I feel I'm having fever, I will check my temperature, and if I reach 38 already, 38, 39, I go immediately to the doctor because over the years I know already I have infection. That's why I'm having fever. And yes, I never go wrong. Whenever I got fever, there is infection. And then a must also, digital blood pressure monitor. Yes, to check my blood pressure. Especially now, I'm monitoring it because I'm having hypertension.
Kailangan parang bubig.
Don't talk while you are checking your blood pressure. See, it's high 150/93. I'm moving and talking a lot right now. That's why. Yes. And next, I must again, ice bag. Ice bag for if I have fever. Yes, I have fever. I have fever. Those I keep here, just near me. Oops. And if I have an ice bag, I also got warm compress, hot compress. So whenever I have stomach pain or any pain that I need a hot compress, at least it's near me. So yes, what else I have here? I have my small notebook for my medication history and doctor's appointment. So every time I see my doctor, I bring this with me. I write here all my questions to the doctor. If I got my laboratory test ahead of time, I write all my questions so it's ready when I see him. And yes, the last time I saw him was May 27, and I also write here the latest lab test results, my lab test results. So my creatinine was 72, GFR 90%. Yes, that is the function of my kidney. I'm stable, thank God, praise God. And what else? Yes, I also write here my current medication. So, whatever may happen, the people here in the house will know my current situation, so they can tell um, the doctor. And also, I write here the important contact numbers and mobile number and email address of my doctor. Usually, I email my doctor if it's not yet my appointment schedule, and I experience some symptoms which is bothering me. So I will email him, and he is really very nice doctor. He always respond to my email. So yes, that's it. That's all my medication, and I hope it will I hope it helps you. You get some tips and in taking the medicines and also organizing them. And yes, for my last tips, if do not change anything in your medication. Do not stop. Do not change anything. The dosage, the timing, always check with your doctor. If you have any symptoms, always consult your doctor, and always set an alarm for the time of your medication so you will not forget them. And if you set an alarm, if it goes on, take the medication immediately so you won't forget them. And then check your blood pressure, monitor your blood pressure, and yeah, always make an inventory of your medication so it will not run out. And then if it's nearly finished, get a prescription for your doctor so you will continually take them. And yeah, that's it. Hope and one last thing, always bring medication in your bag, so whenever you go, so if the time of the medication come and you are outside, you can take your medication. If you are maintaining a lot of medication at the moment, keep a pill box for your medication. So that's it. Hope my tips help you, and thank you for watching my video. And yeah, see you again next Saturday. Bye.